Hey guys, welcome back to my channel. Happy 2025. It's officially a new year. So happy new year. I am so glad that 2024 is over with. It was a rough year and I'm glad to see it go. 2025 is going to be great for all of us. So recently, somebody left a comment on one of my videos and they had a video request in it. It says, can you do a video on how you got through your first few months of post-graduation as a new provider? How you overcame the fear of prescribing something wrong? I tend to overthink everything I'm doing during clinicals and it makes me crazy. So I think this topic really hit home for me because I am the queen of overthinking, not only in my professional life, but in my personal life as well. So when this person left this comment, it really hit home for me. And I'm happy to touch on this topic because as a new nurse practitioner, that feeling of hesitancy in prescribing medications and placing orders really affected me. With all of these new responsibilities that I had, overthinking and imposter syndrome, which I know I've talked to you guys about before, kind of consumed me, and it made me really uncomfortable in those definitely in that first year of being a nurse practitioner. The level of responsibility as a nurse practitioner is totally different than that of a bedside nurse. Yes, you do have the power of life and death literally in your hands as a bedside nurse, but as a nurse practitioner, we're developing these treatment plans and we're placing these orders for staff to carry out. And that's a whole new level of responsibility for us. So it definitely comes with those nerves. It comes with that hesitancy. It comes with, for me anyway, it came with fear, like true fear, like, oh my gosh, not only did I worry about placing the wrong order and potentially harming a patient, but I also thought about silly things like, how is the bedside nurse going to respond to this order? Am I going to look stupid if I place the wrong order? Is this safe? Is my supervising physician going to look at me like I'm crazy and say, why did you place this stupid order? I was nervous to ask questions because I thought that they were stupid questions and I would look silly. In general, I would overthink every single thing. And it was to the point where I would just freeze. Like I would be looking up things on Up to Date. And these are things that I already knew. I already knew the dosage of this medication. I already knew that this medication was safe for the patient. I learned about all of these things and I knew them, but the fear was just so crippling for me that I always felt the need to double and triple and quadruple check every single thing. And then even at that point, I would still reach out to my supervising physician just to get that extra level of reassurance. And then of course they would reassure me and then I would go ahead and place the order. I had a hard time in the beginning being independent and making those independent decisions without getting the okay from somebody with more experience than me, or just getting that extra level of reassurance from somebody with more experience than me. So what I will say to you guys is, if you are experiencing this as a new nurse practitioner, or if you soon will be a new nurse practitioner and you do encounter some of these feelings, it's totally normal, okay? The journey for me through these feelings felt so lonely. I did not feel like I could reach out to any of my other nurse practitioner, friends or people that I graduated with, because I felt like they couldn't relate to me. I felt like they were so confident and they looked so confident in their new roles that they kind of would just look at me like I was stupid or something if I told them how I really felt. It was a very lonely journey for me initially. So that leads me to the first thing that I did that really did help me get through some of these feelings was talking about it. I really do think that there's a lot of value in finding somebody that you can talk to about your feelings. I guarantee you that you are not going to be alone. Talk to some of those other newer providers or even someone with more experience and ask them how they felt back when they were new. And I'm sure they'll tell you. Of course, you do have some of those like overly confident people who are just like, oh no, I was born for this. And that's great for them. But for a large percentage of us nurse practitioners, I guarantee you, we experience similar feelings. I began to talk to some other people just so, I could feel happy and knowing, okay, it's not just me. Another important tip that I'm going to give you guys is you got to fake it till you make it. I don't make the rules, it's just what worked for me. So when you exude confidence, I think that everybody, patients, your coworkers, your supervising physician, everybody takes you more seriously and treats you with that level of respect that you actually do deserve. So the thing is, you have to believe it. And if you fake it for long enough, you will convince yourself. Okay. So when I was at my most nervous, I still walked in with confidence. And when I felt like the nerves were just overtaking me and I began to feel just overwhelmed, I would step away and I would just take a woosah moment and say, that was so scary. And then I would put the face back on and walk back out there. So ultimately, it got to that point where I had to take less of those breaks to step away and kind of collect myself. And the more that I played this role and acted as though I was this confident, experienced nurse practitioner, ultimately I became that person. And so you just really have to be patient with yourself and really believe that you are that person. And ultimately, you will become that provider. Something that I had to let go of was the idea that there is that perfect provider who knows everything, because that person does not exist. Some of the most confident and intelligent providers are the ones that can admit that they don't know everything. And the expectation is not for us to know everything, okay? When there's something that we don't know, it's okay to say, I don't know, let me look into it. You truly are not expected to know everything because no one does. Those people that you think are the most intelligent are the ones who can admit to themselves and to patients that I don't know, but let me look into it. So just release the weight of feeling that you have to be perfect. Release the weight of feeling like you're automatically supposed to know everything. And don't beat yourself up when you do have to look something up. Don't beat yourself up when you do want to double check something to be sure that you are doing it correctly, that your dosages are correct, that your calculation for a pediatric medication is correct. There's nothing wrong with looking these things up because you're not going to be perfect and you're never going to know everything. And once I really realized that, it helped me feel better, and it helped me to stop feeling that guilt of feeling stupid or knowing less than somebody else, because that doesn't exist. You earned your degree fair and square, you have that knowledge, but you're a human being and you're not going to remember or know everything. Medicine is constantly changing. You're always going to have resources at your fingertips. And if there's something that you're questioning, you're going to look into it. From all of the nurse practitioners that I've worked with and met over the years, we are not the type of people who are going to practice in an unsafe manner. It's funny because a number of the physicians that I've worked with have actually told me, you nurse practitioners overthink things and you chart too much on patients. And it's funny that I've actually heard that multiple times. And the thing is, this is what we learned as bedside nurses, okay? In nursing school, we were taught you chart everything. So that stays with you as a nurse practitioner. It's in our nature to double check everything. But there's a difference between double checking and then obsessing over things and letting it cripple you, hinder you, and slowing up your workday. Because when it gets to that point, it can be very problematic. So if you were to ask me how things are now as a nurse practitioner with almost 6 years of experience, I would say that I definitely don't feel nervous prescribing medications anymore or seeing patients anymore. When I encounter something new or different or something that I'm not familiar with, I have a curiosity now. I do not get nervous anymore. I understand that I have my resources. I understand that I have a supervising physician that I can reach out to if I need something. I understand that I don't know everything and some things I haven't encountered just yet. So I just utilize all the resources that I have. So in conclusion, to answer your question, I struggled. That's how I got through my first few months of prescribing as a new nurse practitioner. I struggled through it. I faked it till I made it. And I'm on the other side, and I'm here to tell you that you will be fine. Utilize your resources, ask the questions, find somebody that you can relate to, and give yourself time and a whole lot of patience, and I promise you will be fine. If you guys have any more questions for me, just leave me a comment. I like to respond to all comments. And if you have any video ideas or things that you'd like for me to touch on, I'd be happy to do that. Just leave me a comment, and I'll see you guys in my next video. Bye.